Welcome back to Tampa Bay's Morning Blend, where today we've been talking about mental health, and we're going to continue that with a very special guest. In fact, have you heard of the National Alliance on Mental Illness? Well, we're going to tell you about it because for 33 years, they have been helping people in Pinellas County, and Denise Whitfield is going to join us now. And Denise, I'm so excited, and I feel like this time is such an important time to get across your message with NAMI, as it's better known as. So Denise, take us back a little bit before the pandemic even. Explain what NAMI is all about.
Sure. As you said, NAMI is the National Alliance on Mental Illness. And I also want to stress that, May is Mental Health Awareness Month. And 1 in 5 adults will experience a mental health condition. Mental health has been a top priority for so long. And I just really want to thank you all for recognizing that and having us on here. However, though, there is a stigma around mental health and about talking about your mental health and your mental illness. So NAMI Pinellas is here to change the way we address mental health. Since the pandemic, we have seen over 50% increase of people reaching out through our helplines due to mental health distress. And more than ever, it's very important to let people know that you are not alone during this time. So NAMI is here to offer our free support groups and our education classes.
You're hearing a lot about isolation being one of the key factors why people who are struggling, maybe people who've not had mental illness in the past, are still seeing maybe a family member or themselves starting to feel these feelings of isolation. What message are you able to share with those folks who are feeling these ways and want to do something about them?
Sure. We've seen an increase in reports of isolation and loneliness factors. I mean, even as we reopen the community and businesses are reopening, we really need to recognize as a community that many people will still be in isolation for some time to come. It may be due to those who have to continue working remotely and are away from their coworkers, high-risk individuals as seniors are in ALS, and people are in hospital, and even the fear caused from the pandemic. So loneliness can lead to depression and other mental health issues. So we want to be aware of significant changes that you may see in others, because it may be a sign that that person is struggling.
And speaking of changes, I know you've had to make a few changes with the way that you work with people, and one of them being this virtual component now. Explain some of the obstacles that you're seeing being able to help those people who are in need.
Sure. I mean, we try very hard not to have an interruption of service. So we have moved all of our support groups and education classes online, because it's very important that in mental health, you make eye contact. You want to see somebody's body language, but there's also barriers to that. A lot of people, they might have monthly data plans. So they have to be really careful about how many minutes that they spend online with their cell phone. We also had to move to telehealth. So again, we're always connecting virtually. And again, that might cause more isolation and loneliness. But, we want to let people know that it's okay to reach out, even if it's virtual. Stay connected. It's very important. Send an email, send a text, pick up the phone and call somebody. And that's why it's very important for NAMI that we went virtual, because again, we want to make that face-to-face connection. And the way that we can do it safely during this time is online.
And Denise, of course, we were sharing the phone number there on the bottom. There's also the website, of course, for you to get in touch. And hopefully we're changing that stigma maybe for people that it's okay to call for help. We really are all dealing with our own feelings. And so, Denise, I thank you for coming on today to share your information.
Well, thank you for the Morning Blend for having me, and stay well during this time.